really breaking it down, how effective upper cervical is at helping people and having such little negative side effect, and how satisfied people are with it. 9.1 out of 10, like in 2 weeks of care, over, what was that, 1,000 different patients. Like, that's incredible. So yeah, I would say, because I can think in my mind, I've had a couple of people that have had symptomatic reactions where they were concussed like a few weeks before, and we got them corrected, and so they had a bit of a retracing cycle where their headache got a little bit worse, or their brain fog got a little bit worse, and then they felt the best they'd felt in years. And so it's like, yeah, there's some of that. But
do you tell your patients after the first adjustment, or maybe even the first week or two, that, hey, you might be sore, hey, you might have some, and I do too. So it's interesting to think about the mechanism of that. And I actually, I probably tend to tell and explain too much to patients just because I'm passionate about what I do, and maybe they don't want to know all the details. But I think it's important, and the mechanism being is that when you're changing the structure and the biomechanics and the way that the bones inside of your head and and your neck are moving and articulating, that in and of itself, when you're breaking up adhesion, scar tissue, that's going to cause a little bit of inflammation. Any sort of inflammation in your joints, you're going to get achy, you're going to get pain, and because there's a cervicogenic, a neck related headache that most have, you're going to have that response. And so I tell patients all the time, hey, listen, there's a possibility you might feel these, but this is normal. And unfortunately, I think a lot of our colleagues might not actually tell their patients that, because I've had several patients that I can remember say, oh, well, I went for a few visits and I was sore and it was painful afterward. And it's like, well, they should have told you that was going to happen, because that's part of the healing process. Again, with the relationship of going to the gym and working out, like, it's going to hurt for, it's going to take a while before your body gets used to that, but it's still beneficial in the long run. I think that's really important for people to understand.
Hi there, I'm Dr. Kevin Leach here with the Chiropractic Deep Dive Podcast, bringing you the most important research and information on conservative primary spine care, upper cervical chiropractic care, and traditional chiropractic care. I'm really trying to bring value with these, so I'd appreciate commenting on the videos, hitting the like button, and sharing them with as many people as you can. You never know who might need to see it. And consider subscribing to the channel so you can see all the other episodes and videos coming out. Thank you so much. I truly appreciate your support.